Have you ever woken up, opened your eyes, and everything looks like you're underwater? You blink a few times, you rub your eyes, and it slowly clears up. Most people think that it's just because they are tired. But here's what's actually going on inside your eyes while you sleep, and why some mornings that blur clears in 10 seconds and other mornings it takes way longer, and when it's actually a sign that something needs attention. Hi, I'm Dr. Jafarji. I'm an optometrist with 18 years of clinical experience, and my goal is to address questions about people's vision and eye health that I get daily. And today I want to address why most people's vision is blurry at least some mornings when they first get out of the bed. So let's break it down. So there are several reasons your vision can be hazy when you first open your eyes. Most are completely harmless, but a couple of them are your eye's way of telling you something needs to change. So we are going to go through the 5 most common causes, ranked from the most to the least common in my clinical experience. And I'll tell you exactly what to look out for. So here are the 5 most common causes. So the number 1 culprit is the tear film disruption. So your eyes has a thin 3-layer film covering the surface of the cornea. So there is the oil layer on top, there's the water layer in the middle, and then there's a mucus layer on the bottom which acts like the glue. So while you are asleep, your eyes are closed for 6 to 8 hours. So that tear film gets redistributed, gets thickened, and sometimes it just doesn't spread evenly when you first open your eyes. So that's why you blink a few times and things clear up. You're essentially re-spreading your tear film like a windshield wiper clearing the foggy windshield. If it takes more than 30 seconds to clear, or if you're consistently waking up with dry, gritty, or burning eyes, that's a sign your tear film quality might be compromised, which can lead to dry eye condition, and it's something we treat every day at our clinic. The second culprit is Meibomian Gland Dysfunction. So this is the problem of the oil layer. Along the edge of your eyelids, we have tiny little glands called Meibomian glands. So we have about 25 to 30 on each lid. So they secrete an oil that forms the top layer of the tear film and prevents your tears from evaporating too fast. So while you're asleep, those secretions can thicken almost like a wax. And in the morning, that waxy buildup sits on your eyelid margins and can blur the front of your eye, especially right when you open your eyes. If you also notice crusty or greasy buildup along your lashes in the morning, that's a classic sign of Meibomian Gland Dysfunction, so MGD. So warm compresses and proper lid hygiene can make a significant difference. So the third culprit is sleep discharge, called rheum. So that crust in the corner of your eyes when you wake up is called rheum. It's a mixture of mucus, dead skin, cells, oil, dust that's all accumulated overnight. It can sit right at the edge of your vision and cause some blur until you wash it away. A small amount of it completely normal, but if you are consistently waking up with thick yellow or greenish discharge, that's a different story. That could signal an infection, allergies, or a blocked duct, and you probably should get that checked. So the fourth culprit is corneal edema. So this one surprises a lot of people. Your cornea, the clear dome at the front of your eye, actually needs to breathe oxygen, and it gets most of it directly from the air during the day. So when your eyes are closed at night, oxygen supply reduces. The cornea absorbs a small amount of fluid and swells slightly. So this is especially relevant for contact lens wearers. If you ever fallen asleep in your contacts, you know exactly what I'm talking about. So that thick, foggy blur that takes a while to clear, that's corneal edema. So in healthy eyes without contacts, the cornea resolves this quickly. But if you consistently notice prolonged blur that takes many minutes to clear, especially if you wear contacts, mention it to your doctor. So when is the morning blur a warning sign or when to act? So I want to be clear here. Most morning blur is benign, but there are a few scenarios where it warrants prompt attention. So first is a sudden one-sided blur that doesn't clear with blinking, particularly if it's accompanied by a headache or facial pain or nausea. Could indicate a pressure spike in your eye or a vascular event. Don't wait on that one. That could be an emergency. So halos around lights combined with morning blur and eye pain can be a sign of some kind of acute angle closure glaucoma attack. That's a medical emergency as well. If you get persistent blur that doesn't fully clear in the morning, or the blur is accompanied by flashes or floaters, that should be evaluated as well. So the rule I give my patients, if it clears within few blinks in under a minute, say, you are almost certainly fine. If it doesn't, or if it gets worse over time, that's your signal to book an eye appointment. So what can you do about this? So for most people, morning blur boils down to tear film and eyelid health. So here's my recommended morning routine. So first, you apply a warm compress to your closed eyelids for 1 to 2 minutes. This softens the meibomian secretions and then gets the oil to flow properly. And then you want to gently clean your lid margins with proper eyelid cleanser, which removes the debris, the oil film, the biofilm, and the overnight buildup. If you have dry eyes, use a preservative-free artificial tears before your eyes start to feel bad. So preventatively and not reactively. If you're a contact lens wearer, never sleep in your lenses. If morning blur is happening daily, that's worth a conversation with your doctor. If you like more details on the warm compresses technique or how to pick the right eyelid cleanser, I have a full dedicated video on lid hygiene. Check the description below. So to recap, morning blur is most often just your tear film redistributing and your eye glands waking up. It's a normal physiological process, but quality matters. If your eyes take a long time to clear, if you're waking up uncomfortable, or if it's getting worse, that's worth paying attention to. So your eyes spend 1/3 of their life in the dark. What happens during those hours matters more than most people realize. So if you found this useful, please subscribe, because every week we cover exactly kind of thing, the stuff that about your eyes no one has ever explained to you before. I'm Dr. Jafferji, your ocular wellness doctor. Take care of your eyes, and I'll see you in the next one.